just a quick walkthrough of a clinical judgment activity that can be done in a traditional classroom setting. So starting with what we call the pre-class work, students have to come prepared to do this activity. So what we give them ahead of time is a case report template where they record important information in a very brief shift report from a nurse. They listen to this report and they fill out the template with important information about the patient's past medical history. They also then research some diagnoses and some medications so that they have the knowledge base to move forward with the case. Here is what the shift report looks like. They have the client's basic demographic information, history of present illness, assessment findings. We ask them to identify 5 pieces of additional information that they'd like to know once they've completed the report. So after they finish listening and fill out the other boxes, then they're going to have to critically think and come up with some additional information. So the recording of the data is the recognizing cues and picking up on things about this patient that are important, even if they're not quite sure what they all mean yet, and clustering those cues together. And then they analyze the data that they have once they're done with the report. And then they start to form hypotheses and also prioritize the information, kind of leading towards what they think is happening with the patient. And this is something that they do on their own ahead of time. So just to show you an example of one that's a student might fill in. This is a report on a patient who is admitted with signs of urosepsis. They have some past medical history information, some assessment findings that are relevant to the clinical picture. We then will ask them to move on to the analyze stage of clinical judgment and identify under analyze cues what are some additional pieces of information that they want to know that are relevant to the scenario. So what we're looking for here is not just a list of things that they are curious about, but things that are related to the situation. So if we have a patient with a past medical history of diabetes and congestive heart failure, given the scenario, lung sounds and blood sugar might be something that they would like additional information about that they didn't receive on the initial report. As long as a student can defend their choice on what they think these additional pieces of information are, it really leads to a good classroom discussion that's facilitated by the instructor. We also ask them to connect past medical history to their current presentation. So what is the relationship between diabetes and a history of heart failure when it comes to a patient presenting with symptoms of urosepsis? And we want them to think through that. Under social history, we ask them to start thinking about things like discharge planning and safety, everything from room assignments to making sure that we're aware of fall risks in patients based on their presentation and social history. And students will do this again in the blue ahead of time and then come to class and we'll talk through it with them. Once they arrive in class, we begin the case, and this can be done with any video-based case study. We oftentimes will take kind of an established video and break it down into segments that are facilitated by the instructor in the front of the room. And we will, show them little pieces and then ask them to make decisions about the direction of the case based on what's happening. In addition, we want students at this point to be able to respond to changes in client situation, reprioritize interventions, identify additional concerning findings that might be pointing the patient in a different direction so that we know that they can respond to changing client scenarios. And we do that with a thing called clinical curveballs. So during the case, we will, at any moment in time, challenge the students to address a new piece of information that is unexpected and kind of shifts the trajectory of the case. Things like a client reporting chest pain, a client having a fall, a client with an abnormal or critically abnormal lab. And we sort of ask them to stop what they're doing, shift their thinking, and address this new issue that's popped up. And that is a way to ensure that they can be flexible thinkers and not so concrete that they can't, see the forest through the trees. Once the case is done, we think it's really important that they reflect on what they took away from the case so that they can build that intuitive thinking that's really important to clinical judgment in nursing. And we ask them to do that by answering some facilitated questions. So we asked them of their confidence in the decisions that were being made during the case, what part of the simulation they found the most challenging, and what part of the simulation they think went really well. And then we asked them what would they do differently next time if they encountered a situation like this. And for us, the formative assessment that we get from these discussion posts is helpful because it identifies for us gaps in learning and things that the students find challenging from week to week. It also shows an incredible amount of growth in the students over time, and it kind of allows us to make that growth visible to them. And it's important to sort of get them on board with the idea of the clinical judgment model, and they sort of see the difference between their confidence level and their own decision making from the beginning of the semester to the end, and especially their confidence in tackling unexpected changes in client situations, which is something that they really do struggle with and makes them very anxious in the clinical setting. And we can do that with them in this really safe environment that still does kind of stimulate that flexible thinking, but in a way that the students feel, is, like I said, is safe and is comfortable for them. And that's the activity. It usually takes about 2 hours, but can be done a little bit quicker depending on the discussions in the classroom. And the qualitative feedback that we've gotten from students is that they really enjoy this activity. We've gotten everything from this is the most thinking I've ever done in a nursing class to this is the first time I've actually felt like I was making nursing decisions in the classroom. And we've also seen some quantitative improvements on clinical judgment style questions on objective exams from the start of the semester to the end. So we think it's beneficial for the students. It's fun to teach, and we're happy to share it with anybody who's interested in teaching clinical judgment in the traditional classroom.